All right, so we're going to just jump into the questions. And of course, the number one question on everybody's mind is how many positive patients are in the county today?
Right. Yeah, so I think I apologize if I repeat information that I've already shared with you, but the days kind of and the weeks are kind of blending and blurring into each other. But hot off the press, Kathy Whitman, who's our infection prevention manager, sends out a daily email and usually sends it for the previous day's results. But I had told her that I had this virtual meeting today with our community engagement folks and asked her if she could give me a real up-to-date, real-time reporting. So as of, I guess this would be today, as of 9 a.m. this morning, we have now collected specimens from 895 people. So those are inpatients that are in the hospital right now. Those are physicians, providers, employees, and community members that have been referred to our specimen collection sites either by the county or a private physician or by our own organization. So 895 specimens collected. Of those 895, 48 have tested positive. I shared with you, I'll give this to you again. I think it's interesting to see the distribution, the age distribution of these 48 positive cases. 3 of them are in the 0 to 19 age group, 18 of them in the 20 to 29, which continues to be the single largest group that are testing positive for the virus. 7 in the 30 to 39 age group, 5 in the 40 to 49, 4 in the 50 to 59, 4 in the 60 to 69, 6 in the 70 to 79, and 1 in the 80 to 89. Interestingly, we heard early on that the most vulnerable segment of our population was going to be those folks that were in the older age categories. 93 of the 895 that we have tested are 70 years or older, 98 of them. And only 7 of them, of those 98 in that more vulnerable age category, have tested positive. So again, it's interesting to see it's the young people that are testing the most positive, which is why I think a lot of the public service announcements, I was just driving to work today and I was hearing folks implore our young people, while they may feel less vulnerable and better able to fight the effects of the virus, that when they become contagious, then they potentially could expose people that don't have the same strong immune system. So just asking them to be very, very mindful of that. Of the 48 that have tested positive, 5 of them have been inpatients of the hospital. We've had many patients, actually we've had 131 inpatients that were admitted for various reasons. They could, again, have been admitted for pneumonia or a heart attack or whatever it might be, although many of them being admitted because of having respiratory issues, suspicious of the COVID virus. But 131 inpatients have now been tested and only 5 of them tested positive. So virtually all of those that have tested positive have been outpatients. As of just minutes ago, I stopped by the command center on my way here, and we currently have 4 patients that are in-house that are positive for the virus. And also, as of today, we still only have 1 death that was attributable to the COVID virus. We did hear, I think just yesterday, or maybe it was the day before, that the county now has its 2nd confirmed COVID death, but again, only 1 of them at our facility. And I don't think the county report revealed where that second case, where it occurred. So those are the latest statistics. I did hear also this morning that we've only had 2 employees, so only 2 Kaweah Delta employees that have tested positive. And both of them are home, quarantined and recovering at home, which is very encouraging to hear that only 2 of our employees have tested positive, which to me tells me that we're doing a pretty effective job protecting our employees and our physicians and our residents, following our personal protective equipment or PPE protocols, and making certain that we're doing everything we can to minimize exposure. And so that's been very good to see.